I had the opportunity on behalf of my co-authors to present on the long-term durability, safety, and efficacy of Fitusiran prophylaxis in people with hemophilia A or B with or without inhibitors. And this is results from a phase 2 open-label extension study. So Fitusiran is an interesting molecule. The primary defect in hemophilia is ineffective clot formation due to insufficient thrombin generation that's caused by missing the clotting factor, factor 8 or factor 9, or the presence of inhibitors to those factors. And what Fitusiran is a small interfering RNA that's designed to lower antithrombin levels. Antithrombin is one of the natural regulators of thrombin burst. And so by lowering antithrombin, this improves thrombin generation, even though you're not replacing factor 8 or factor 9. So this is already previously shown is well tolerated and has been able to boost thrombin generation in a phase 1 study. And so now this is the longer term phase 2 open label extension, which has included 34 participants who've now been followed over a median of 3.1 years, but a maximum of 5 years of dosing with this drug. This is subcutaneous administration. It's given once a month as a fixed dose. And the patients actually, we see that they're within just a little more than 2 weeks after their first dose of Fitusiran, that their antithrombin levels fall to about at or below 20% of normal. And as long as they remain on the monthly subcutaneous prophylaxis, it maintains their antithrombin levels stably at that level. We've now been following these patients, as I said, for a median of 3 years, and the annualized bleed rate, the median was 0 for treated bleeds during the observation period, with really no significant difference whether it was in hemophilia A or B patients or presence or absence of an inhibitor. When we look at the types of bleeds that the patients are reporting, the bleeds tended to be traumatic related for the most part. The locations still included primarily into joints, but also muscle and other bleeds. And overall, in general, the bleeds were rated as mild. Patients treat breakthrough bleeds with substantially reduced doses of either factor products or bypassing agents, depending on their underlying condition. And that's because with the combination of the antithrombin knockdown, they don't need as much replacement therapy to get them the proper thrombin burst that they need to treat a bleed.